How does diabetes affect your feet? Today, I want to go a little bit over some of the ways that you can help prevent developing an ulcer or developing an amputation with your feet. I really want to go over everything that you can do to prevent problems with your foot. And this is something for you if you're my patient or if you're watching this. I think you're going to find this very, very beneficial in this episode. So today we're going to go over a little bit about how diabetes affects your feet. And the reason I put this initial picture here is because it shows this is someone that's developed almost an ulceration on the bottom of the foot, and we want to learn how to prevent things like this on your foot. So I want to give you first a couple of patient examples. These are all things that they're kind of scary pictures, but these can happen very easily if someone has diabetes. And you might be wondering, well, this is never going to happen to me, or I can feel things. Well, you have to just be aware that if you develop a callus or an ulcer or a blister or things like that, these don't even hurt. And these could lead to limb threatening problems. You could lose a toe, you could lose a foot, things like that. So I want to talk a little bit today about what are the main things that you can do to prevent these problems. So let's kind of get into it right now. The first thing we have to look at is blood flow. So how is your blood flow? How is the circulation? You can do this by feeling the pulses on your foot. You should have a doctor check this out. Look at the capillary fill time. That's where you push the tip of the toe to see if the blood comes back. If there's swelling, a lot of times swelling around the ankle specifically can cause problems, or even swelling on the foot. If you have a wound, a lot of times that wound is drained out. It drains out where that cut is with the swelling. Another thing that you want to keep an eye on is varicose veins. Sometimes varicose veins can be a problem. And then you have to have circulation studies. This is an example down here in the bottom of something called an ankle brachial index. This is where we evaluate the blood flow that's going to the toes. And it's a comparison of your arm blood pressure to the ankle blood pressure. Another thing that you want to look at here is the skin exam. Are there any problems with the nails? Is there any nail fungus? Are there any calluses? Are there any corns? The big problem with calluses and corns are that a callus and corn pretty much always precedes an ulcer. So the same place that this patient developed an ulcer is the same place that there was a callus before. Also looking for dampness between the toes. That's something that's a concern. Athlete's foot. And then obviously if there's an ulcer needs to be healed as soon as possible so it doesn't get infected. A lot of patients we see that just have these chronic ulcers because of the calluses and things like that. There are some newer treatments now where you can kind of put padding underneath the calluses. They're starting to kind of in an experimental phase still. The other thing you want to look at is the feeling exam or evaluating for neuropathy. This is a simple test that we do here in the office where we kind of poke the tip of the toe and we try to determine if you have feeling or not. That's really what you have to have for the gift of pain. I call it the gift of pain because if you can feel that, you're probably going to be okay if you step on something, you're going to notice it. We also look at the vibration and other types of things when evaluating. This is evaluating for neuropathy. There are certain types of neuropathy that are painful, others that are non-painful. So really, to prevent a foot wound, you have to certainly know if you have any neuropathy. And then if you have neuropathy, you have to be extra careful because that's the easiest way that these ulcers happen because of the lack of sensation. Another thing you have to look at is the bone and pressure exam. So basically, are there bony deformities in your foot? Do you have a bunion? Do you have a hammer toe? Do you have this condition called Charcot foot where your foot collapses? All these things are very important. And something that really contributes to it is a tight heel cord. You have to really be careful if you have this tight heel cord. This can really put more pressure in the middle of the foot and the rest of the foot and cause problems. And then basically there are different recommendations that we give our patients. The most important thing is look at your foot every day. If you can't see it, you can take a mirror, you can use a phone, an iPad and record it looking at the bottom or have someone look at it for you. That's real important. Circulation studies, I recommend these circulation studies if you have diabetes over the age of 50 or if you're not diabetic over the age, a little bit older, over the age of 70. Okay. Do you have diabetic shoes? If you have diabetes, you can usually qualify for one pair of diabetic shoes a year. And I use this new company now that actually goes right to your house. So it just works a lot easier to do that. And also, any other types of the insoles. Some people ask, why do I need these diabetic insoles? Now, these aren't made to be really rigid orthotics. What these do is they reduce friction on the bottom of the foot, and they reduce risks of ulceration and blistering. But they also, with a diabetic shoe, you're going to make sure that it's wide enough for you. Okay, so those are a few things. I do have some learning resources. I'm going to put a little card here so you can go get these. I have a healthcare guide to diabetes in your feet you could read, and also a book on wound healing. I would also recommend you go to like a local diabetes support group. I think that's really, really important. If you have one in your local community, that would be good. They usually have a foot section, but if you're learning about feet, you probably need to learn about other things, which isn't really my specialty, but that's something that I advocate. Also, there's a great book by Dr. Fong that he wrote called The Diabetes Code. If you haven't read that, I think it's just a great primer. It kind of explains how diabetes happens, and more importantly, different ways of helping to control the blood sugar levels and even possibly reversing the diabetes. Everyone asks me, how do I deal with my neuropathy and other types of things? The best thing you can do is reverse your diabetes or get rid of the diabetes to begin with. It's not an easy thing, but there are some tips in that book. So it's a very good book that I recommend. And then basically, this is my diabetic foot checklist. So this is really how to prevent problems. If you have any issues, you should get an X-ray, an MRI, or an ultrasound. If there's any skin problems, you'd see a doctor possibly for a biopsy. And the main categories: blood flow. How is your blood flow? Are you having vascular studies? Do you need to see a vascular surgeon? You have to do anything with compression? Skin. How are the nails? Do you have any ingrown toenails? Any wounds? Any other areas? Do you have any high pressure points, whether it be from the top of the shoes with a hammer toe or a callus in the bottom that needs padding, that needs orthotics? How is your feeling examination? Do you have any neuropathy? Is there any medications you need for that? And then blood sugar and nutrition. Really, that's with your endocrinologist, a nutritionist, doing your own learning about the diabetes. And basically the recommendations are this: look at your feet daily, get your diabetic shoes, and I recommend reading that book on the diabetes code. I really think you're going to like that. So hope you found this helpful. If you did, please subscribe and download this information that I put some of these other books.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.